we have patients with liver cancer, and there's a lot going on therapy, as we already implied for all our listeners. And Amit, I would like you to please help us first. What treatment options are available for liver cancer at this point? If you can give us an overview about that.
Yeah, so there are multiple different therapies that are available for liver cancer. And these therapies are not given by a single specialty, but they're instead given by multiple different specialties. So if one is found at an early stage, we often have procedural, if not surgical therapies available, including surgical resection, liver transplantation, local ablation. And these are curative procedures where your average survival is well over 5, if not over 10 years. These are typically given by surgeons or interventional radiologists in terms of procedures. And now we're starting to see even adjuvant therapy, systemic therapies given in some of these patients after undergoing some of these surgical therapies. If one is found to have larger liver localized disease, but not amenable to these surgical curative procedures, then one can do embolic procedures where one injects small beads directly into the cancer that can contain either chemotherapy or radiation therapy, induce responses in many of these cancers, and prolong survival. These are called chemoembolization, radioembolization, for these these tumors that are refined to the liver. And then finally, if one has larger intrahepatic disease or has disease that has spread outside the liver, but the liver is otherwise still functioning well, that's typically when we have systemic therapies as the mainstay of treatment. And as we'll discuss there, we've seen a shift from chemotherapy or targeted therapies to more now using immunotherapy, leveraging the immune system to attack the cancer, cause responses, and improve overall survival. I think one of the key things that one takes away when one looks at this overview is that we have lots of different therapies that can improve survival at each of these different stages. But the decisions between these different therapies can be quite complex. And the key thing is that it's important to be seen at a center when all of these different therapies can be considered. So to be seen in a multidisciplinary format, where multiple disciplines are sitting down, discussing that cancer care to come up with the best therapy for that individual person with liver cancer.